Welcome to Leading with Purpose, the podcast that's dedicated to helping you become the leader you aspire to be. Join us on a journey of self-discovery, empowerment, and inspiration as we explore the world of leadership and personal growth. In each episode, we will explore the art and science of effective leadership, bringing you insights, stories, and strategies from experts and thought leaders across various industries. And now your hosts, Dawn Marie Bornhammer, Maisha B. Hoy, Janelle E. Taylor, and Dr. Sharon H. Porter. Welcome to Leading with Purpose, the podcast that's dedicated to helping you become the leader you aspire to be as you lead, empower, inspire, and achieve. I am Dr. Sharon H. Porter, Editor-in-Chief of Vision and Purpose Lifestyle Magazine.
Hi, everyone. I am Maisha Hoy. I'm the CEO of BSHG LLC, which manages and markets MaishaLemonadeStand.com, QBob.com, and Customer First Marketing.
Hello, everyone. I'm Dawn Bornhammer. I'm the Founder and Chief Impact Officer for Mission Inspired Consulting.
And we are truly excited to welcome Mr. Dan Bonner. He is a dedicated healthcare advocate whose personal journey fuels his mission to transform the patient experience. After a life-changing liver transplant at the age of 32, he became acutely aware of the emotional and mental strain medical procedures place on patients and their families. His experience navigating the healthcare system exposed gaps in patient support, particularly in education and mental health. Mr. Dan Bonner, welcome to Leading with Purpose podcast.
Thank you so much, Dr. Sharon, and to Dawn and Shaisha for having me. I appreciate that very much.
Absolutely. And just really reading about all the things that you've endured, it really is fascinating and truly the epitome of turning your pain into purpose. I would love for you to start by sharing just the story of your liver transplant and how it truly impacted your perspective on healthcare.
Sure. You could imagine, being a late 20-something-year-old person who was diagnosed with a liver disease that is known to be fatal, where the only treatment is indeed a liver transplant. And there was a lot of speculation as to not me having the disease. It was confirmed I had the disease, but how long would it be before I needed a transplant? Some doctors thought it would be, years. Some thought it might be decades. But it was a very difficult time because you still want to live your life with as much purpose as you can. And without trying to think about or plan for, the potential inevitable transplant. But then once it came along that the transplant was indeed inevitable, that's when, your world really starts to change quickly. From a healthcare perspective, you are inundated with doctor's appointments and terminology and all different types of experiences that there's no guidebook on how to deal with them. You're trying to live a normal life with your friends, your family, maybe, a significant other. And then professionally, you're just trying to hold down a job. And all these things that are occurring are competing for your time and attention. And it's very difficult to maneuver and to navigate all the challenges that are hitting you all at once.
I can't even, really conceive just all the things that really you went through, your family, and just notably why you chose to now advocate for for patients during this process, simply because you experienced so much and you identified the gaps. I just commend you on really truly taking that pain and turning it into purpose. And now that you're helping so many other individuals through all that you have gone through. So I just want to say thank you. And I'm glad that you're on the other side of it now. Just very grateful for that.
Well, I appreciate that, Dr. Sharon. And I I mean, I still continue to experience, periods where I feel let down by the healthcare system. And the thing that I guess really concerns me the most is when my medical journey started, I was 24. When my transplant journey started, I was 29. And I was somewhat tech savvy. I had wherewithal. I had a phenomenal support group. I could get myself to and from doctor's appointments. So I had access to a lot of sort of basic resources that you need when you're facing a challenge like that. But statistically speaking, I'm in the minority, and in a lot of ways, a very small minority of people who do have access to those resources.
Wow.
And I just thought, what about all the people behind me that don't have the support group, that don't have the resources, that may not have the wherewithal, and have difficulty advocating for themselves? What happens to them on their journeys? And I just thought it truly terrified me.
Yes.
Because it could result in procedures that may not have been necessary. It could result in emotional hardship that may not have been necessary. And just filling in some of these gaps can make a world of difference in the people who are having these challenges. And I think ultimately it wouldn't even be a huge investment on the healthcare system. It's really just doing the little things that could go a long way. So it's those things that I'm fighting for, and trying to use my voice for, because as everyone here knows, the healthcare system is complicated here in the U.S. Lots of rules and regulations and this and that, and it's easy to get swallowed up into it. And I'm trying to prevent that from happening to as many people as I can.
Wow. Thank you. Well, it's very commendable. Thank you.
Thanks, Dr. Sharon.
I'm glad that you brought it up, because I was like, I don't want to softball this guy because he's actually doing the work. But let me say, as a 31-year-old colon cancer survivor, I have a little bit of knowledge about the process and the importance of your work. But my question is about, how are the hospitals and the pharmaceutical companies and your clients that you work with embrace this philosophy that you're putting out there about holistic patient care and caring about patient outcomes?
Well, I first need to comment on the cancer diagnosis and the overcoming. That's not something you gloss over. You got to take a pause. And I mean, that's a huge win. So congratulations for that. That's,
Yeah.
yeah, that's, you just glossed over that. Like, whatever, I won $5 in a scratch off. Like, come on, that's, it's a little bit more important than that.
I thank you for that. But it's, you may be able to maybe talk about this a little bit more, but I was so young that the impact didn't hit me until after I was writing a book with Dr. Sharon and Dawn. And then I relived and recried and re-celebrated all of that. But I do thank you for taking that time out. Yes, I am a colon cancer survivor.
Very good. Congrats. I feel like I should interview you for this podcast. But I think what's happening now in healthcare, and it's a really interesting time in healthcare, is there's more and more pressure on healthcare organizations. And I'm using that term broadly because a healthcare organization to me, or a healthcare company, could be a hospital, it could be a pharmaceutical organization, it could be a governmental organization. There's a lot of pressure to incorporate the patient idea and the patient perspective in everything that they're doing. And what's the healthcare systems in particular are trying to make their care very specific to each and every person. And in order to do that, you really have to dig into each person's story. And I understand the level of complication to it, because the nuances for all of the different types of diseases and things out there is almost infinite. So it's almost like trying to, catalog fingerprints in such a way that we can make it meaningful. So I commend the healthcare organizations for doing that. But in order to do that the right way, they need to hear from a lot of people like me, like you, Shaisha, people who have these incredible stories that are valuable, not just face value valuable, but the experience, the heartache, the challenges that you felt, how you overcame those challenges. All of those components need to be built into the healthcare system so that we're thinking of and we are allocating our resources properly. This isn't going to be a quick fix. It's going to be a difficult, long journey to get there. But I applaud the healthcare organizations for taking those steps and for continuing down that road, even though it's filled with uncertainty and not quite sure, how to actually apply it yet. But with more people involved, I think they'll get there.
Well, I'm happy to come and help and advocate for the patients anytime. And I do, again, want to thank you for this work, because it is very important that we have hospitals focused on patient care. However they get there, is the most important thing is that they do.
Right. And if I could just say this, Jay, my medical journey
Okay,
now
Dan, it's Maisha. Like,
Maisha.
don't think
Oh
it's
my
your
God.
Isha, but Maisha.
Maisha. That is Maisha fault. So I apologize for that.
No problem.
I
The first time
apologize
I
for
let
that.
it go. The second time I had to say
No,
something.
you got to correct me. The names are most important. And I'm turning beet red because I put so much emphasis on names. I truly am sorry. That's not,
No worries. No
I
worries.
apologize. Maisha. I forgot what I was saying, but
We're saying the most important thing that the hospitals get to this one-on-one patient care.
right. And I was, in my experience, it's now been almost 30 years since I've been involved in the healthcare system, and never, and I want to sort of emphasize this with people who are listening, never has a single clinician or someone from within the healthcare system ever asked me how I'm doing. Never. How am I handling these problems? Am I struggling with certain things? And the one time that I raised my hand and said, "Hey, can I talk to somebody? Because, this kind of a big pill to swallow, no pun intended," was in 2016. I found out that my liver disease had returned. And the doctor came in and said, "Hey, look, we just want to let you know, the liver disease is back, over time, you know how this goes. You're going to get sicker. You're probably going to need a second transplant." And I said, "Sure." And I said, "Is there somebody from the mental health services that I could just have a conversation with?" And the nurse says, "Okay." And she leaves and she comes back with the attending physician. He closes my door. He shuts all the blinds in my room. And he says, "I just talked to the nurse outside and she said that you're depressed. Are you depressed?" And I was like, "No, I never said I was depressed. I just asked to talk to somebody because I just got a major diagnosis and I just kind of wanted to have somebody to talk to." And he was like, "Oh, okay." And he goes, "I'll get you some names of people and you can give them a call." That was in 2016. I'm still waiting for those names. So, and in your experience too, I'd be curious to know if anyone ever asked you if you're doing okay, because more times than not, nobody has.
Yeah, no. I mean, again, no. And I do recall that they came into the room. They came into the room, they look at your chart, say 1,000 words, and then they kind of leave and you're just stuck in your room. So yeah, no. No. But I had a great doctor. I do want to say that. I did have a great doctor.
And that's just it. The world is filled with great doctors. But in order to improve the overall healthcare experience, I think we can't just treat the physical. We have to treat the mental, the psychological, the emotional as well. And so to me, there should be a great, doctor who's handling the physical in the room and a great doctor who's handling the emotional in the room, because they go hand in hand, in my opinion.
No problem. And the one thing, I just watched your video and I'll let my co-host come on, but the one thing, I watched a video about perseverance on your website. I do encourage everyone to go to his website and watch it. But the people, my peers, my support group said that I had a great spirit about everything. I just persevered through the cancer diagnosis, the surgery and the chemotherapy, knowing that at the end I was going to prevail. So.
And I agree with you, right? That, there's lots of reasons why people are successful, but I think that we could make it more successful for people if we provided the right sort of spectrum of services. And it's not just the physical, treating the physical component of it.
And that's why we have you.
Well,
thank you.
Thank you, Maisha. I apologize. I'm gonna have nightmares tonight about. Oh my God, that's so rude.
Don't have nightmares. It happens all the time, which is why I come up with it's not Eurisha, but Maisha.
Maisha. Well, like I said, that's my fault. So I apologize.
So Dan, I'm really grateful that you brought up a couple of really important pieces, which is social determinants of health. They serve as a barrier to certain individuals receiving the same level of care that everyone is, supposed to be afforded, and access to care and the ability to feel that layer of support. I believe NIH really released a paper back in 2012 saying that patient navigators were to be in every hospital system and available. And those patient navigators are the people who have those softer skills to help a patient understand what's happening to them, understand the big words that are being said, help them process that information. And I recognize that that is not happening at the level in which it was requested to be happening back in 2012. And I had the pleasure of working with the Ullman Foundation, which is a cancer foundation out of Baltimore, Maryland. And they advocate for patient navigators for the very same reason that you're advocating. I would love to hear from you about how you're using your voice through keynote speaking, through other engagements, to really elevate this conversation in a way that we can reach the everyday people, both who may be a patient tomorrow, maybe an advocate for their own family member, maybe a caregiver, or the very people that can impart change inside of these systems.
Yeah. And I mean, all of the points that you brought up, Dawn, are super excellent points, because you're absolutely right about the timing of, and for a long time, the buzzwords were, we're going to have patient navigators all through the healthcare system, and we're going to handhold people through the process, and it's going to be great, and everyone's going to love the healthcare system. And it never materialized. And if we sort of take a moment to understand why it didn't materialize, I think to no one's surprise, it comes down to finances, right? I mean, the hospitals are, they're ultimately, businesses, and they have to be aware of finances and allocate their financial resources properly. And I think that over time, you start to see sort of a growing number of these patient navigators that are sort of initially were infiltrating the healthcare system, and hospitals didn't understand the value add of those navigators. Mm-hmm. And I don't think that anyone ever took the time to understand what the downstream financial impacts were of those navigators. I recently, and this sort of dovetails into, the types of things that I'm doing to try to change that. But a colleague of mine and I, we recently presented at a conference in Philadelphia, the American Transplant Conference. And we were talking to basically clinicians within the transplant community from around the U.S. And our presentation was about the patient journey itself, and how navigators, we would advocate for navigators for sure. And some of the directors of the programs, the transplant programs, just bottom lined it and said, "Hey, if you could just give me one piece of advice right now, what would it be?" And I said to them, I go, find whoever your best patient is and hire them. Hire them to be the spokesperson for your department, because there's no one better to advocate for your healthcare system or your department within a healthcare system than somebody who's been through it, is a model patient, understands the lingo, and can convey that over and over and over to the people that are coming in. And my philosophy, or my guess, is that if more and more hospital systems did that, you would see the downstream effect wouldn't necessarily be 100% financial. But I think immediately in the short term, you would see increases in hospital survey responses. What was the quality of service? I think you would automatically see it go higher. patient satisfaction scores would be higher. But then also too, patients would start recommending that their friends and family come to that hospital for care and services, because why wouldn't you? You know, Maisha was talking about, like, she had a great doctor. That great doctor for her is probably sealed on her heart like a, you know, like a handprint. And she would recommend to everybody, and I'm speculating, Maisha, but she would recommend to all of her friends to go see this doctor. And if you were doing that consistently within that healthcare system, you would start to see that return. And I guaranteed, I was like, if you had somebody who is as outspoken as I am, or as passionate as I am within your system, and you put them in front of people, don't check your finances 6 months from now. Check them a year from now and 2 years from now, and tell me how much your program has grown and how your survey results have improved. And there's your empirical evidence that shows the impact that the navigators could have on a healthcare system. And I think it would totally easily justify their existence within the healthcare system.
No, you make a really good point on the financial side. Unfortunately, like, the line items are something that some of these leaders need to pay attention to, are forced to pay attention to. But it is the human aspect of it, and being able to feel seen and heard at a time where you receive some really challenging information that you not only have to process, but need to make some pretty immediate decisions about. Inside of a lot of information that doesn't make sense to you, having somebody that stands in front of you that has been there and that can assure you that you are going to be in good hands goes a long way in your ability to feel comforted in that moment. And so I think that's a great bit of advice, and you had the opportunity to be asked that very question, and I'm excited for people to have the perspective that you're offering to them, as someone who very much pays attention to those things. But I know that there are plenty of people in the seats that you were in, and you and Maisha were in, that are looking for that level of support. So
Yeah,
thank you.
absolutely. And if I'll share just a brief story with you, Dawn, but there was, and you know how this usually happens. I'm sure, Maisha, this has happened to you. You get a friend of a friend who is talking to your friend and says, I know somebody now who needs a transplant, who has colon cancer or thinks they have colon cancer. What can I put them in touch with you to, you know, share some stories or share information? And of course, the answer is absolutely. So I got a phone call from a friend of mine saying, a friend of hers husband, you know, is trying to get listed for a liver transplant. Can you talk to her? Sure. Her and I spent about an hour on the phone, and I was getting her ready for an appointment the next day that she had with her healthcare team, or really it's her husband's healthcare team. And she called me the day after, and she goes, Dan, you're not going to believe this. She goes, the medical team thought that I had a nursing degree with how much information I had on transplant. And they were just super impressed with my level of knowledge. And she thanked me for that. And that's the kind of impact that we can have on people. And I'm not sitting here sharing the story to say, look at me, I'm just sharing it. Is when you take the time to educate people and give them the information that they need to feel comforted, to feel like they have wherewithal, to feel like that they can make a good decision with all of these crazy terms that they've never had before, crazy medical experiences they've never had before. And they can all of a sudden feel empowered and knowledgeable and encouraged to move forward. Mm-hmm. That makes a world of difference, particularly when you're dealing with such significant diseases or situations that have big implications on someone's life. So that, you know, to me, that's just, we just need to find a way to do more of that. Yeah. You know, I wish I could open up a transplant hotline and Maisha be on the cancer hotline, and, you know, like, and just people call in all day, and I'd be happy to answer your questions all day long. You know,
education is powerful, and for people to feel better equipped to go into a meeting that has such high stakes, to feel better equipped to engage in the conversation and ask their own questions, is important. And that's absolutely what that role is designed for. That patient navigator role was designed for, but in execution, you were that human being for her that day. that she really needed. And you were able to allow her to feel empowered in that moment. So
Yeah. And I think too, what was important too, Dawn, was not just the conversation itself, but I gave her sort of the right questions to ask. Because so many times, when you're listening to information, sometimes it's information overload, and you're like, I have no idea even where to go from here. But when you have an idea of the way things are going to unfold, or the information, you can present it in such a way that's easy to understand and follow. Then and some questions that I would say, I would definitely want to know this. I would definitely want to know that. And she made her her cue cards and everything like that, put them together, and she got all her questions answered. But she walked out of there feeling really confident in the healthcare that they were pursuing and that they were receiving from the healthcare system now. And that wasn't in existence just 2 days before.
Yeah.
So those are the impacts that we can have. And it's rewarding. And again, this isn't about me. I need to emphasize, this is not about me. This is just something I feel very strongly about, very passionate about, just trying to pay it forward,
and you're doing that. You really are. So that's reflective in that story you just shared. So thank you.
I'm trying, Dawn, but I'm definitely going to set up an 800 number for me and Maisha, and we're going to bang out a couple hundred sick people a day. Sorry, Maisha, I just volunteered you for another job you had no
Yes, my
desire to
name
do.
has come up a lot. Absolutely happy to do it. No problem at all.
And you know what? That's just it, Maisha, right? There's no doubt that people who've had similar experiences want to pay it forward, right? We're so grateful for the opportunity to still be here, to be healthy, to be contributing members of society, that if we were presented with opportunities that could help the next person behind us in any way, shape, or form, most of us, I think, would jump at the opportunity to do that.
Absolutely. I get, like, as you said, I get calls. Maisha, I have this symptom, this symptom, this symptom. Like, first, I'm not a doctor. Please go to the doctor immediately. But calls all the time.
See, Maisha, I take a different approach. I go, tell me, what's going on right now? Because I joke, Maisha, that I got my medical degree from Wikipedia, because that's a highly accredited medical institution.
Oh, please, Dan, stop. You're losing your credibility as you speak.
That's great.
Okay, Dan. So you talked a little bit about the emotional support that's needed in addition to the physical, right? What would you say are other pressing issues today in our healthcare system?
So insurance is a really difficult item, I think, in and of itself. And let me just talk a little bit about that for a second, because, and I apologize, I don't want to get too bogged down into finances, but insurance is really confusing. And I'll if I could, I'll just use a story. This is my own experience, and it just happened. I have my transplant hospital that I go to, who handles everything from a transplant perspective. And I was recently displaying symptoms of sort of an ancillary issue and had to go to see a specialist outside of transplant. So my transplant team recommended a medical team within the hospital system itself. So essentially, same healthcare system. I'm just not seeing transplant anymore. I'm seeing another medical team. I go to the medical team, and long story short, I get a bill saying that medical team is outside of my insurance network. And the bill that I was expecting was now literally 10 times larger than what I thought I was going to be paying. And I appealed this through my insurance company, through the hospital. And of course, they all said, nope, this is patient responsibility. And the case I tried to make to them was to say, you as a hospital or you as a healthcare system accept my insurance, but yet this medical team within your healthcare system does not. So how would I know that they don't accept my healthcare or my health insurance? And that is a really challenging problem I think that all healthcare systems face, because I'm one of probably a million people that this probably happened to today, somewhere in the country. And that's a big problem. We have to sort of get to a point where there's more transparency within our insurance benefits and whatnot. And on a very sort of basic level, right? If you were to go to a grocery store and fill up your cart with groceries, you have an idea of what you're going to pay for those groceries. If your grocery bill was 10 times what you thought it was, my guess is some things are going to go back. Maybe everything goes back and you don't shop there anymore. Why is our healthcare system like that? That when you go to the checkout, you get your bill and you sit there and go, wait a second, I had no idea that this is what this was going to cost. How do we get it so that we can know in advance, what something is going to cost? And then maybe, just maybe, we could choose to go from one healthcare system to another if they're providing the same service but at a cheaper price. I mean, I will go from one grocery store to another if your price of bananas is cheaper. I will do that. As ridiculous as that may sound, if your bananas are 59 cents and yours are 39 cents a pound, I'll see you at Aldi to 39 cents a pound bananas. And that's, I think that's sort of what happens in our healthcare system is there's not enough transparency. And I think, it's costing the patient exorbitant amounts of money in aggregate, all patients across the country every year.
Now, do you think that's intentional, or is it just the care, that thought of transparency is just not on the minds of the big healthcare system?
I think, Dr. Sharon, that's a great question. And I wish I knew what the real answer was. I've researched it as much as I can, without getting into trouble, so to speak, because, to get a healthcare system to open up their books to me and show me how things work it's not going to happen. But my understanding is that hospitals in particular will contract with like doctors that are in, let's say, private practice. So let's say for a second, I'm Dr. Dan Bonner and I'm in private practice, but I'm a heart surgeon. If I'm going to be a doctor, Dr. Sharon, I might as well go big, so I'm going to be,
Oh, yeah.
I'm a pretend heart surgeon all of a sudden. So I have a private practice where I see patients in my practice and I accept certain insurances, but I have a contract with the local hospital that allows me to use their services, their sort of facility to do surgeries and things like that. So whatever insurance the hospital is under is different than the one that I have. And there's lots of nuances that go on about who pays when and things like that. And if somebody stays longer than what a diagnosis code is, who pays that? And there's times if somebody has to be readmitted because, maybe the insurance company thinks that it was Dr. Error, then the hospital has to eat that. Like, it's a really, really complicated process. And is that intentional? I would say no, because I don't think anybody is sort of that manipulative to come up with such a spider web of options. But I think we sort of have to peel it back and get to a basic level of a foundational level of, insurance and transparency that gives the end consumer, in this case, patients, a better shot at figuring out, where's the best and most affordable healthcare
Most
that
affordable.
they can
Absolutely.
get. Yeah,
Thank you for that. Thank you.
sure.
It's me again, Maisha.
Maisha, my favorite person.
So you and Dawn were talking about the patient navigator being in the room. And it got me to thinking, with all the work that you're doing, who else should be in the room? The great doctor should be in the room, but who else would you have in that room or in that experience with the patient that would help them have a better outcome?
Again, I think that's a fabulous question. And I have to give it to my transplant center, because when you are indeed in need of a transplant in my healthcare system, they have sort of an orientation day where you meet with all of the doctors from the different areas of transplant that'll be taking part in your care, social workers, finance people, basically sort of everybody that you could potentially want to meet with throughout the day. You're meeting with those people, and it's a phenomenal experience. The problem, though, is that it's only that one day. So when, in the early stages of transplant, they basically just say, okay, this is sort of the path that you follow as a transplant patient. But Maisha, nobody prepares you to say, okay, hey, Maisha, we're going to list you for transplant tomorrow, which is November 7th. And imagine this, because this is what happened to me. And the dates are going to change, but just for, context here. So I was at the hospital. They said, you're going to be listed for transplant tomorrow. Tomorrow will be November 7th. And because you're so sick, Maisha, we expect you to be transplanted in the next 7 to 10 days. That's what we expect. So now we're looking at November 14th to the 17th, where you could be transplanted, right? So what happens, Maisha, when December 17th rolls around and you're still not transplanted? Now you're much sicker than you were. You're not hearing from the hospital. There's no more dates now that they're aiming for. So who do I talk to? Who can I call, or who can be the people in the room that I can go meet to have a conversation with? And that's where we have to get better at, because in that situation, you absolutely need, like, your pre-transplant. That in this particular case, they do have a pre-transplant physician, but that social worker or somebody from mental health also needs to be in the room at the same time. So to have sort of a full circle conversation. So it's kind of situational, but anytime I think that you're going to have a difficult conversation emotionally, that there should be an emotional, healthcare provider in the room, along with a doctor that basically mostly deals with, the physical symptoms.
Thank you for that. I'm just wondering, because I'm working with a behavioral health agency, and speaking of everything you said resonates as far as complications, bills, Medicaid, all of that goes into it. So knowing who should be in that room is something that we can advocate for on behalf of our clients as well.
Mm-hmm. And truly, if I could write the script for healthcare providers, not for regular checkups, but if somebody was coming in to get a diagnosis or an update, and we knew that this was not going to be something that the person was either ready for or had heard before, you absolutely need to have somebody who represents the physical side and the psychological side. Absolutely. Every single time, without fail. And I don't want to, frankly, like, I know that I may sound very pie in the sky when I say this, but I don't want to hear that there lack of resources. I don't want to hear that. Because the patient, their well-being is what should be paramount. And if there's a lack of resources, then let's do the needful to go out there and try to encourage people to study those areas and be more active in those areas, so that we're not in such dire need of resources. So I feel very strongly about the biggest gap in healthcare is you have this, the whole physical side is taken care of. None of the mental side is taken care of. And that's the gap.
Your passion is coming through. It's coming through.
Well, and that's just it. I know, it's a difficult sell, because I know it's lack of resources, and I know that you can't assign a revenue stream to a patient advocate or a patient navigator. I get it. I'm a finance guy by person. I do get it. But I also get the fact that if you help one person and it's a valuable experience for them, it'll pay dividends, much higher dividends, downstream than the hospital, I think, really accounts for.
Well, I hope everyone is listening to Dan Bonner this evening or when they hear this podcast, because I think you did actually talk about outcomes earlier. Quality of service, more referrals, that leads to revenue, right? So hope
Absolutely.
everyone's listening.
So, Dan, one of the things that you brought to light is the struggle with the insurance and simply understanding the nuances of that. And I think that's just one pocket of things, right, inside this patient experience that can be very muddy or very confusing or unnecessarily difficult to figure out. Thinking about Maisha's question about like who should be in the room, I think it brings to light a couple of things. I think that we all know that we have certain levels of comfort with certain types of information, and depending on our experience with that information, we may be more or less versed in all the language and nuance. Where do you see the space for streamlining some of the information that is being given to a patient that they have to sort and sift and organize? What does it look like to go beyond the electronic medical record and say, like, how does a patient feel that they not only have all the information, but they have an ability to like review it again after consuming so much and process it with that person that we're envisioning belongs in the room with them?
Right. And it's such an important question, Dawn, because I think you'd mentioned like digital healthcare records, right? I'd imagine that all of us here, and probably most of us, that'll listen to this, they have some sort of app into their healthcare system where, if they go for the test results get posted and you can speak about those results with your doctor. That's both terrifying and probably helpful for exactly the reason that you said, because different people have different levels of understanding of information.
Mm-hmm.
Let's handle the good side first before we, tackle the not so good side. But the good side is once you get a comfort level of the information that is in your test results and things like that, and you've had the disease for a long time, like, I'm coming up on 20 years with transplant, so I'm very comfortable with the information that comes through, and I know it pretty well at this point. So the chances of there being surprises in my test results is really minimal. Even if they were bad results, I'm not going to be, I wouldn't be necessarily caught off guard by that. And I would know how to handle that. The downside of it, though, is, and this is the other side, is for people who may just be newly diagnosed, or they don't have a good comfort level of the information that's shared and provided. And, they get their results and, God forbid that person goes out to like Google and just starts entering in, test results. You are quickly going to be overwhelmed with lots of medical information that is not synthetic. It won't make sense. But I think as humans, we pick up on the most sort of dire things in there. People will pick up and say, oh, this was fatal, or this could be fatal, or this could be cancer, or this could be, so next thing you know, you have somebody who's sort of a newly diagnosed person is walking away from their test results going, that's it, I got cancer, 6 months to live. And that may not be anywhere near what the truth is. So I think healthcare has a challenge in front of them. And I'll use this word again, is to synthesize data at the right level for the person at the right time. And I think, again, Dawn, I think this is a very difficult thing to execute properly. I think it could be done. But if you were to sort of look at a patient from sort of day one to day infinity of their diagnosis, here's day one. The amount of time that you're going to have to spend with this patient is going to be really high. But as time goes on, it's going to come down because you're going to be synthesizing that information over a period of time at a pace that this patient is comfortable with. I think that's that is one approach to do it. That's the approach that I think would be most effective. But I also understand it's also most time consuming to do that. But I think if we were going to do it the right way, it doesn't necessarily have to be on a one-on-one basis. If you had a situation where, I don't know, for privacy reasons, if there was 10 newly diagnosed colon cancer patients this week, that on Friday we're going to have sign this paper that says you're okay to talk about your diagnosis with other people. We're going to have a 1-hour class on, an introduction to colon cancer.
I think it could also be done in a more private setting, right? If people are not in the position where they want to be in a room. I mean, it can be, certain pieces of information can be delivered in different ways. It could be delivered through like a video piece of content. I just think what we have to be able to do, like you're describing, is scaffolding, right? Scaffold the information in such a way that it is in real time at the most important time. And maybe day one, I don't need to learn about the insurance and about the diagnosis and about the navigation and about the pre-op and the post-op and all the things that go into this, because it's easier for the system to give me all the information at once. That is not the easiest way for me to process, digest, and make informed choices. And so there may be an opportunity for that scaffolding to happen with some thoughtfulness, and some of the information delivered by a very caring human and other information given and provided in a private setting. So I have time to process in the way in which makes sense for me, and maybe have my person, right, spouse, friend, sitting next to me, because that feels safe for me to receive this part of the information. Or maybe a person who's going to help me figure out the insurance paperwork with me in that moment. And people aren't necessarily given those choices when everything is being pushed in their direction at the same exact time.
And Dawn, I feel this requires a huge pause for a moment, because what you just said and the way you said it 1,000 times better than me is 1,000,000% correct. You couldn't hit the nail on the head more direct than the way you just phrased that. What you said is exactly right. And it's exactly what the healthcare systems need to do. And how do we get to what you just said? Well, that's where patient advocacy and patient navigators come in to say, hey, Dawn, granted it's a whole learning process, but you're a newly diagnosed colorectal person. How would you like to receive information? Would you like to receive it in video form, Zoom form, in-person review, whatever the case might be? And you start to piece all those together, then that's your roadmap. That would ultimately become your roadmap. And if you can execute then on that roadmap effectively, it's exactly what you just said. And Dawn, I swear to God, that's what needs to happen. What you just said needs to happen.
Yeah, and I'll just close with this idea that in an instance like this, where so much of your personal agency has been taken, giving back some personal agency to help decide how you receive this information, process this information, and the support you need around yourself should be part of choice inside of the experience. And I love what you're doing. I appreciate it. I think these conversations need to continue. I'm grateful that I'm reflecting back to you some of what you are fighting for, because people need it. So thank you.
They do. I appreciate it. After what you just said, though, I think I can retire now. You just said everything perfectly. That's
Well, we gotta still go save the world, so we got a little bit of work to do.
I'm there with you. I'm there with you. So, but that was truly excellent insight. Well said.
I'll send you a bill.
Oh my God, Dan, this has just been so amazing. Just the information that you shared tonight, your thoughtfulness, the passion behind it. I just want to say thank you, first of all. Thank you for being this light for all of those patients out there who undoubtedly need your guidance. So we do want to give you this space to share your information. Where can people connect with you, follow you, and seek you out should they need to?
Sure. If I could just flubbing Maisha's name 100 times, this has been a great experience. And I appreciate what the three of you are doing in the leadership space, because, you know, in order to execute on some of the things that I'm trying to do, it does take a certain amount of leadership qualities that I'm not so sure I always have. And I am constantly looking for areas of motivation or inspiration to help guide me. And it's, you know, podcasts like this that helps me do those things. So I certainly appreciate what you guys are doing. People can reach out though, through social media if you want. You know, my email is dan@danbonner.com. My website is https://danbonner.com. I've recently started, you know, putting out some TikTok videos to, you know, just to share more of my story and try to hope to get more people just watching and listening, because I want to talk. I want to actually start talking to more people. It's so hard to get in touch with patients on a one-on-one. So if there's a broader way for me to do that, I try to take advantage of those opportunities as much as I can. This being a great opportunity. So again, I genuinely appreciate you having me on here tonight.
To our viewers and our listeners, we want to thank you as well. We want to thank you for joining us for another episode. And this was an impactful episode of Leading with Purpose podcast today. And again, I am Dr. Sharon H. Porter.
I am Maisha Bihoy.
And I'm Dawn Marie Bornheimer. As you navigate your leadership journey, remember that leading with purpose is not just a philosophy, but a commitment to a positive impact.
And if you enjoyed today's episode, please share it with your network, and don't forget to subscribe so you will never miss an opportunity to explore the intersection of leadership and purpose.
And everyone, be like our guests. Continue to lead, empower, inspire, and achieve.
And until next time, lead with passion, lead with a positive intention, and by all means, continue to lead with purpose. Thank you for joining the Leading with Purpose podcast. Please join us every Monday for a new episode.